Today really is another step in our journey our county is taking about providing the right care to the right person in the right way. And it was just over 3 years ago, our Board of Supervisors made a commitment to do a couple things. One is to invest in behavioral health services in a way we had not done previously. And that was bipartisan and that was across the board. As a county, we felt like we had to step up our game. We had to do more to be in a position to meet the needs of those suffering from mental health and from substance abuse. But the second part of this was equally important, which was we recognized and realized that we had to build the right continuum of care. So much of the debate up until that day was about how many locked inpatient psych beds we need. And what we recognized is the need for those beds is a damning indictment of our failure to provide people better care before they reach such a state of crisis. And so everything we have done from that day until today has been about building a system to get the right person, the right care in the right way. A CSU provides a vital piece of that. Absent a crisis stabilization unit, individuals who would be brought here would be taken to an emergency department, an ED, where they wouldn't get the level of behavioral health services they need. They might get the level of physical health things if that's what was ailing them or causing them problem, and they wouldn't inherently get connected into an ongoing system of care in the best possible way. Crisis stabilization units play a critical role. And with now 5 plus our youth one and a 6th one coming online, we know that we're not only alleviating pressure on our emergency departments, but more important to that, we are getting people the right care, the right engagement, the right counseling, the right treatment plan, the right ongoing level of support and services they need. We know that this works great for law enforcement. It's easier to drop someone off here than taking them all the way down to Rosecrans or getting clogged up in an emergency department where you could sit there for hours waiting to offload them. We also know that law enforcement isn't the only folks that can bring people here. Family members can bring people in. Our mobile crisis response team, which again is designed to get the right care to the right person in the right way, can alleviate a burden on law enforcement and get them here. We know that they can only stay here 23 hours and 59 minutes, which is why the person-centered care coordination is so important. It's why the outpatient services that we are adding. It is why the board and care and the step downs and every other piece of this continuum is designed to have someone live at a better place of community care and care coordination and not rising to the level of extreme crisis, locked inpatient psych bed, stable, and then discharged back to the streets. And so crisis stabilization units are one piece in this system that we are building, and they are a very, very, very important piece of that. And so this location here, our North Coastal Community Case Stabilization, again, 24/7 walk-in, drop-off, help and support, and adds to the array of CSUs throughout our county. We know we're maintaining an average diversion of about 95%. I was just talking to Dr. Garcia about this. Only about 5% of the folks that come here have to be discharged here to a higher level of care. And that's an incredible thing. We're able to assess them. We're able to treat them in that first 23 hours and 59 minutes to get them into a lower level of care. And again, with the right follow-up and the right engagement, they can live in that world of a more healthy, productive life without rising to the state of crisis. And so these CSUs, again, are incredibly important. They also go hand in hand with everything else we're doing. Under Sheriff Martinez is here, is leading the effort as we integrate better our jail system of care. We're adding significantly in mental health clinicians and substance abuse counselors in our jails. We're working with Rady Hospital on a youth behavioral health hub. Our mobile crisis response teams, I mentioned our comprehensive harm reduction services and everything that is going into that, along with looking at behavioral health hubs and everything we can build. And so again, congratulations to everyone here. Mayor, we appreciate the partnership with the locals. We know that you see the conditions in your city every day, and we're here to be a partner. I also want to say that we appreciate the embrace. A lot of communities will tell you to deal with issues of behavioral health until you come up with the solution. And then the minute you have a solution, they'll say, well, not here. Go put it across the street in the other city because it's real. No, this isn't everywhere. And Oceanside, time and again, you've stepped up, and we appreciate that. Really appreciate the cooperation of law enforcement, both in us better equipping you for when you have to encounter a situation and us better equipping people when you don't have to be involved. Really appreciate, last thing I'll say, that the support of our district attorney, who has devoted tremendous energy and tremendous resources and effort to issues of mental health and substance abuse. And I think all of this is really coming together. And so what we see today is actions that were put in place a few years ago, But again, it is a piece, and if we keep doing our job right, we will continue to have groundbreakings and ribbon cuttings. But again, all is a part of a continuum of care that'll get people better help and services. And so really appreciate the effort, and want to commend Supervisor Desmond for his support on this. We're here up in North County, and appreciate the visit and appreciate all the work. And just thank you to all the providers and workers who will make this a reality. So a good day for San Diego County, and a really important part of what we're trying to do overall. So thank you all very, very much.